Hello, this is Mitch, your logical libertarian here. I am going to talk to you today about Medicare for All, which is a very popular position, especially when it comes to progressives and more liberal people. It's something that I've seen a lot of people talk about. Some form of universal health care, single payer system, typically, again, Medicare for all. Bernie Sanders supports this idea. I believe AOC, Cortez, I believe she supports the idea. I've heard other politicians like Obama and Clinton support other forms of universal healthcare or healthcare reform. And I wanted to go over today some of the issues I've been able to see in the idea of Medicare for all, as well as offering some things to consider if you're going to try and push legislation for Medicare for all, and things to consider if you're ever voting on it. So I know that I doubt hardly any politicians would see such a video, but this may have some useful information and useful things to consider, especially if you are not familiar with how healthcare works and the insurance side of it. Because with Medicare for all, the government would essentially be the insurance. They would be the health plan, and they'd be determining how you do that. So, a few things to go over first, and I have some visual aids to help. If we were to look over here, this is a website I went to just kind of go over some of the averages. It's not perfect. I think it's called debt.org, but it goes over some things like the annual premiums and annual co-pays, or average co-pays. A large amount of different things, how they've increased, how premiums work, a lot of different things, deductibles. It's a pretty decent resource. You can look up this kind of stuff. Over things too, such as PPOs, HMOs, EPOs, differences between those. Something that's really important to go over is how Americans kind of already deal with that currently. Now, in California, it's going to be higher than what I'm proposing, but the national average, based off these types of sites, for medical premiums, and again, that would be for individual family medical premiums, is going to be between $440 per person up to about $1,160 per family. So that's fairly expensive. That's, for the average American, that's a mortgage payment or a car payment. That's really big. And I understand that healthcare is extremely important. It is a necessity in our world. And it's something that should definitely be taken seriously. But things like this you need to consider. Now, when we look at the average deductibles for these plans, they're usually between $1,000 and $3,000 for the typical American. For about half of Americans have that. Some have a little bit lower, some have a little bit higher. Most of those statistics are kind of spread out, but typically it's 1 to 3,000 is the area where they have. Very few have over 3,000. Very few have under 1,000. Those are the typical deductibles. 500 would be about the next most common. When it comes to copays, typically people pay about $25 for a primary doctor visit, $50 for a specialist, about $100, up to $100 for an urgent care visit, and $300 for their emergency visits. Prescriptions too can follow that anywhere from about $15 to $100, depending on if they're getting generics or brands. So you have all of these for the private sector, which is what is in the way of the Medicare for all proposal. That's where the Affordable Care Act really went in, is instead tried to have reform towards the private sector and how the private sector worked. Some things helped, a lot of things didn't. It actually ended up helping insurances in the short run more than it actually helped citizens get affordable healthcare coverage. Now, when going over Medicare, and I got some information on Medicare if we want to take a look at that as well. Now, this is going to go over different things like Part A and Part B. As you can see, Part B, the average premiums, depending on how much you make, can be anywhere from $135 a month to $460 a month per person. So it would seem like it's definitely cheaper in the long run, and with more people on it, it very much could be at first. Now, going over some of the other information too, the average deductible seems to be about $1,000 to $1,300. It didn't go over much for copays, but I would imagine they're pretty similar. It seems that a lot of times the co-insurance is going to be 20% for most things after the deductible is met. She'll be paying about $1,000 to $1,500, and then 20% for everything else. So 20% for your doctor's visit, 20% for your labs, your prescriptions, everything like that, with a few things being $0 cost. Now, there is an implementation, again, Medicare approved, Medicare approved, Medicare approved. That's something we're going to go over in a little moment, and I'm definitely it's going to be very important in a few moments. So going over all of that, we see that there is easily at face value an argument for Medicare for all. It seems like it'd be cheaper, and if you were to think that everyone would then be on it, of course you would assume that prices would go down, everyone would pay a lot less. So many people are under that $85,000 a year bracket that they would be paying. You would think they'd be paying so little, or only $135 to $150 a month for that. Their deductibles and other things like coinsurance and copays don't seem to be much different, if not maybe a little bit better. Other things I couldn't find, I probably could have found if I dug a little bit deeper, were things like out-of-pocket maximum comparisons and the like. Those are the things that would those would make a big difference as well. Out-of-pocket maximum is important. That's where the line is drawn for you to no longer have to pay anything. And again, all of these numbers I've been going over are referring to in-network providers. That's going to be important in a few moments as well. So jumping into it, some of the implications that would come with this, and some of the things that I think politicians need to consider, is one, as I said, it would be important, network status. Now, a lot of times, especially as it used to be, when it came to things like PPOs especially, network status was something you didn't have to worry about too much, because you usually had coverage that applied to both in-network and out-of-network. And there are a lot of plans that still do for PPO. But for many people, the coverage has gotten less and less valuable for out-of-network, where people have been left with a lot more to pay, and the amount the insurance covers is a lot less, with higher out-of-network deductibles and other things like that to really try to incentivize people to go in-network. The problem with that is that in-network pools are based off of contracts, and as well as the desire for accepting the amount that an insurance company will pay for your services. So where this plays into Medicare is that in order to have these benefits apply, first the doctor needs to be in network. Medicare needs to approve them, so they need to be contracted, which means they need to accept how much the government, Medicare, is willing to pay for these services, and accept that as paid in full. So that's the first problem. You have to be able to contract, and doctors are legally allowed to not contract with insurance, including programs like Medicare, Medicaid, if you're, any other government program that is designed to offer public, federal, or state, or even local assistance for medical costs. So with that in mind, you have to consider, how are you going to entice providers to want to be contracted with you? because they may just all not contract, and then people will have to go out of network anyway, and then you've completely wasted your time, and you have a pointless law that now wastes money, wastes people's time, and just greatly increased the amount people will pay at first. It may decrease over time, but you just skyrocketed the amount they pay because they're going out of network. Out of network has no insurance coverage or protection. You are screwed. Another issue would just be rising healthcare costs in general. It's something that really sprung on this discussion in the first place. The fact that not only are insurance premiums rising, but they're rising due to the fact that everything's getting more expensive. Doctor's visits, hospital visits, prescriptions, other services, and more services coming out that seem to be necessary. We're deeming it more and more necessary for people to get certain preventive checks and everything else, and other required services due to scientific discovery on what things have effects on healthcare and what would push to be a healthier life. So in order to increase that quality of life and increase that quality of health in general, with those changes, it raises the cost of health insurance. And it can also affect the cost of things like your deductibles, your copays, your coinsurance, your out-of-network deductible, or your out-of-pocket maximum, your prescription copays. It can affect all of that. And when it's all monopolized under one roof, like Medicare for all, you then have no competition to allow for a natural balance to form. Currently, we don't have a natural balance because we've had it legally be mandated, and it created a sort of monopoly for that entire industry where people have to buy a certain product, similar to how we've done with like car insurance. So with that, you end up having to realize you have to face that. Are you just going to increase taxes? How are you going to address the rising costs for doctors in order to pay them what they have to pay, because they're now more expensive, their practices are more expensive? How are you going to address all of that? You need to make sure you address these things, and you need to be thinking about these things. Another point I brought up earlier is approval or authorization. Now, insurance, private insurance, in order to pay for certain things, especially any invasive procedures, anything that is either only recently FDA approved or not FDA approved, drugs that are questionable or are highly addictive, a whole number of things, even if it's just something that's really expensive, requires prior authorization. It requires the insurance to be notified, for the insurance to have medical review by medical professionals, to then determine whether or not this is something that is medically necessary, because insurances do not want to pay for things that aren't deemed medically necessary, like certain plastic surgeries or anything that's deemed cosmetic or strictly voluntary and elective that does not have any effect on your well-being. Say things that are any other things like homeopathy or massage therapy. A lot of times those are not considered medically necessary. At one point, mental health was considered that way too. Luckily, we've advanced, so we may advance further with other treatments like this too. But it's something you need to consider. With the government being involved, is the policy supposed to be more liberal? When I mean liberal, I mean being more loose with the money of taxpayers and this program to pay for more things, or is it going to end up becoming much more difficult? We understand so far that public programs, or at least government programs like veterans and Medicare, take a long time for authorizations. They can. We know that other nations' universal health cares can take a long time for authorizations for services. Services where private insurance can usually get an authorization within 1 week to 1 month at the most. That's something you need to consider. Either a way to logistically make the system more expedient and efficient, or consider if that's going to be the standard and see why. If it's just because it's just way too big a task to take on for one government entity, perhaps it's better to keep the private sector open. The other thing, the danger, now granted this is a bit conspiratorial, but there is a large fear of people, or at least people are very afraid of, the potential for the government to essentially be deciding who gets a quality of life over someone else. Is it going to be first come, first serve? Is it going to be based on your race, based on your gender, based on your financial capability? Are the poor going to be left to die all the time and the rich get to the front of the line? Are the rich going to be left to die and the poor get to the front of the line? There's a lot of things people worry about. Now they use the term death panel, which I think is rather ridiculous, and I don't think he's going to come to that. But essentially, there's the potential when you have something like this for it to be not done properly and to have people have their mental or physical stability be ruined and potentially cost them their careers or the quality of their life. That's something you need to consider. It's something that health insurance needs to consider. And the other problem when it comes to this, the legal aspect, is with insurance being done private sector, the government can then be an overseer of it. The government can be law enforcement for the laws and regulations on insurance, on their practices, so that way they are held accountable. It's a lot more difficult to hold Medicare accountable or to hold a public sector program accountable because it is an element of the government itself. That's one other danger. The last thing I'd like to go over is what will happen with private sector and going out of network. Obviously, people will probably be left to pay on their own, but will it be considered illegal? Will it be considered illegal to practice out of network? Will it be considered illegal to go to a physician out of network? How will that happen? How will that work? There are definitely a lot of positives you can have, especially if it's done at the federal level. You could have it to be where it's an entire nationwide network. The question would then be, how would you handle going across the seas, overseas? How would you handle other things? And is there going to be any coverage for out of network? Those are the things that need to be considered. How are you going to implement this? Throwing out the numbers that I did at the beginning, like, well, it'd be lower cost. How much do you pay in copays? Those are nice, but that doesn't mean that it's what the public will get, and it doesn't mean that that's not going to be extremely costly on our tax dollars, or even potentially on our own freedom when it comes to seeking medical care. What's going to happen to concepts like continuity of care requests? What about people who can't pay their premiums and they end up getting terminated? Are they no longer going to have coverage? Do they have to pay it all up at once? How does that work? You have to consider all of these things. Many people don't. So again, thank you to everyone who's watching. Thank you to everyone who has watched. I'll check the chat to see if there's any questions to answer. It seems that we are not streaming. So, thank you.